Next up, we have two individuals who will approach the podium. We've got Mary McDevitt, who is a RN, a nurse navigator, and Alicia Reeves, who's the director of referral and assessment. Mary's the nurse navigator at Penn State Health, St. Joseph, and her nursing career has focused on critical care, cardiac catheter lab, and emergency room nursing. And Alicia has over 10 years of experience working in acute care and community mental health settings. She's the director of referral and assessment at Haven Behavioral Health Care. Please join me in welcoming Mary and Alicia.
All right, I want to thank you guys for having us. We are going to highlight what we do together. St. Joe's and Haven has joined together to make an effort to help people. We operate out of St. Joe's. So it's different. We partnered to respond to community crisis needs on a 24/7 basis. So at any point in time, at any stage in recovery, at any stage of desire, you can come to St. Joe's and get help. Whether that's 4 o'clock in the morning, that's Christmas Day, that's your birthday, we're here 24/7.
I work in the emergency room at St. Joe's. I've been at St. Joe's approximately 34 years. My role in the emergency room is a nurse navigator, which means I try to help people navigate through the healthcare system. So in the emergency room, our main goal when the patient comes in, they usually arrive, well, they do arrive by two different ways, EMS, or they're dropped off by somebody by car. Sometimes they're dropped off in not the best conditions, and so in the emergency room, before the Haven gets involved, our job is to stabilize them, stabilize their vital signs, protect their airway, get them awake, and then when they are finally medically cleared by the ER physician, then they can be referred to, we always have an ABH intake person in the ER to help with the placement process if the patient wants to be placed. Recently in the emergency room, towards the end of 2015, we were participating in a program with TASK and the Council of Chemical Abuse with the warm handoff. So we have cards, we keep them with the charge nurse, we have them in my office, we have them out in the waiting room, we have them in critical care. Sometimes patients end up, unfortunately, being on a ventilator and going to the intensive care unit. So then these cards, when the patient is able to respond, if they want help, we can call this number and somebody, a recovery specialist, will come and meet them at the hospital, be it in the emergency room or somewhere inpatient. A lot of times though, unfortunately, once the patients are reversed with Narcan, they want to leave. So, and because of HIPAA, we cannot release their name. So what we do is we will hand out the card. And, maybe they'll put it in their pocket, and maybe a week, 2-3 weeks down the road, they'll think about, maybe I want help. And they'll have this card, and that number will be there. Our nurses do patient education that they put out in our waiting room. So for January, one of our nurses picked heroin addiction as patient education. She put up a poster presentation, and I put the cards and the flyers out there. And I've noticed, I've been checking on them, and I've noticed that the cards are mysteriously disappearing. So it's good. Somebody is picking up those cards and flyers because they keep replacing them and they keep disappearing. So that is promising.
Okay, from there, after St. Joe's does everything that they can to stabilize the patient medically, Haven can step in. We perform behavioral health screenings to anybody who is needing those services. So we go into the patient's room, we sit with them, we ask them what's going on, we ask questions varying from, what substances are you using, how are you feeling, are you having suicidal thoughts, what is going on? So we just really give them the opportunity to speak and let us know what's happening. Those services can be accessed, there we go. So we do the medical screening, and then we have the behavioral health screening, and we do everything that we can to give them the acute treatment services that they can. The services can be accessed directly. The client can ask ask for the consultation. They can ask, I need to talk to somebody about depression or substance use. Or when they come in and they overdose, the physician can request that consult as well. What patients can expect from us is that they are going to meet a Haven assessment referral specialist who is trained in crisis intervention and they're not matching mine. Okay. So they meet a Haven specialist who is trained in crisis intervention, and they can expect to have confidentiality from our specialist as well as respect. We present in a non-judgmental manner. We want to help the patient. We want to do everything that we can to give them the services that they need and meet them where they're at. We're not there to judge them for what they've been through. We're not there to, criticize them for what they're using or what they're experiencing in life. So they can expect that from us. They are also encouraged to be truthful about what's going on, because we're not there to shame them. We need to know what they're using, how much they're using, so that we can give them the right treatment options. And patients also have the right to choose what programs they go to. They get to participate in choosing, I want to go to this area, or maybe I need to go 2 or 3 hours outside of my hometown so that I can really get treatment that is going to help me and pull me away from what's causing me to go into treatment, to substance abuse. So they get an active role in their treatment. Slides don't match. We at Haven offer 2 main programs. So when they come in, what we can do is we can give them that screening. We let them know what is available for them. At Haven, we offer acute mental health services for people who are suffering from primary mental health issues. So we have 2 programs. We've got our inpatient program for adults, that is inpatient psychiatric care. Those programs are typically for suicide, homicidal ideations, psychosis, severe depression, that sort of thing. And then we've got our partial hospitalization program that consists of coming to group therapy. You get to meet the psychiatrist in that program. You have medication evaluation. You get to be an active part of your treatment. You meet daily and Monday through Friday. And then you get to go home and function in your daily life. So those programs are fantastic for people who are recovering from substance abuse. After you've completed detox, you've come home, maybe you've come out of a residential program, but you still need a little bit more support. So that's a great program for them, that they can get the services that they need on a daily basis and get that extra support. From there, what I would encourage many of you, one of the things that we talk a lot about is what is actually going on with the person who has the addiction, and we give them that treatment. But what I would say is also consider the families. Consider how devastating this can be for each family member, the parents, the children. A lot of times I would encourage you to talk to those people, see if they need something, check in with them. Do everything that you can to connect them with the task force and connect them with support groups and everything as well. And if at any point, they pop up and they say that they need something a little bit more intensive, get them in contact with those sources as well. And there's our info.